Hi, everyone. Thank you so much for joining us this afternoon. We're really excited to present this topic to all of you. This is the first time that we've done a webinar about vector-borne diseases. And due to a variety of factors, many of them are increasing in different parts of the US. So it's a really important topic, and we're excited to present it to you all. And like I mentioned before, we have several experts in this area from the CDC who have graciously joined us. And so if I can't answer your questions, then hopefully they will, or we'll be able to find someone who can. I'm a very informal presenter, so yes, please feel free to use the chat to ask questions whenever, and I will periodically stop and check for any questions that come up. Okay. So today's training is aimed at clinicians, at healthcare providers, but if you do not have clinical training, if you do not have that background, that's okay. You'll get a lot out of this training, and we'll be mindful to explain certain terms that might be unfamiliar to folks who do not have a clinical background. But today we really want to help folks understand some of the differences of some different vector-borne diseases. This topic is so vast. We've really focused today on just arboviruses, and we'll dive into more of what that looks like. But we're going to talk about some key arboviral diseases that are important to farm worker communities in the US, and talk about what that looks like clinically, as well as testing and treatment and prevention strategies for those diseases. So vector-borne diseases, for folks who maybe aren't familiar with this term, that happens when a pathogen is transmitted to us through another living organism, like a mosquito, a fly, or a tick. Globally, almost 1 in 5 infectious diseases are vector-borne, and probably one of the most common ones that when they think about global health is malaria or dengue, possibly. Here in the US, West Nile virus and Lyme disease are two of the most common vector-borne diseases that we have here. So these pathogens get transmitted through different vectors, and it's really easiest to think about them by the type of pathogen that is getting transmitted. So there are viruses, there are bacteria, and there are parasites that can all get transmitted by these different vectors. So here in the US, some viral ones that we have are West Nile virus and dengue. Occasionally, those get transmitted by mosquitoes. A common bacterial disease is Lyme disease that many of us have heard of. Not so common, luckily, is the plague, which we all probably remember from middle school history class. That gets transmitted by fleas. And then, as I mentioned before, malaria is actually a parasite, and Chagas disease is another parasitic pathogen that gets transmitted through bugs, through kissing bugs. All right, let's talk a little bit about farm workers and how vector-borne diseases relate to them. So just background info in case folks on this call are not familiar with farm workers. There are around 2.5 million farm workers in the United States, and that includes people who work with crops and people who work in animal production. Most crop workers in the US are from Mexico, and most speak Spanish, but farm worker communities are very diverse, and it really varies depending on where you are in the country. So you will meet farm workers who are from Haiti, from Jamaica, from Central America or South Africa, and they may speak many different languages. About 1 in 4 live in overcrowded housing, and we'll talk a little bit more about why this might be a concern for vector-borne disease. And about 3/4 of farm workers earn less than $30,000 a year, and we think that about half do not have health insurance. So all of these factors, because of the nature of the work and because of policies about agricultural work in the US, this creates several vulnerabilities for farm workers in terms of vector-borne disease. So the first is really low incomes, because low incomes will often mean poor housing conditions, reduced access to healthcare, and workers have to work longer hours in order to survive. Those longer hours put them at increased risk of being exposed to the vectors, right? To insects, to ticks, to livestock, all these things they're going to be more exposed to, and other factors that could impact them and make them more susceptible to getting really ill when they are infected. And then, of course, we have kind of a major concern that if farm workers are infected with an infectious disease, because of a lot of policies we have in the US, they might not seek healthcare treatment, or they might have a lot of challenges in seeking healthcare treatment. And this can affect all kinds of things like reporting and how well we can track these types of diseases in farm workers. And then, of course, how well and how quickly we can treat them for the diseases. So I have a question for y'all, and you can put your thoughts in the chat. When we think about overcrowded housing or poor housing conditions, why would this be of concern for vector-borne diseases? If these diseases get transmitted by mosquitoes, fleas, and ticks. I'll keep going while you guys think about this, but please put your thoughts in the chat, and I'll pause when I see an answer. Another key risk factor that we want to think about is just not only because of what farm workers are exposed to here in housing and at work, but also because of the regions that they often immigrate from. So many parts of Latin America, there's a high prevalence of vector-borne disease. And so they may come already with a vector-borne disease, and then they're experiencing, the elevated risk because of their job or because of their housing while they're here. And so we've seen some elevated risk of Chagas disease, which is that parasitic vector-borne disease, of having malaria, dengue, and West Nile virus, all and then also of Lyme disease and some other tick-borne illnesses. Yeah, so Sarah mentioned as it relates to housing that there might be an increased risk of rodents, so like rats or raccoons possibly, or mice. And we'll talk a little bit about the zoonotic cycle in a moment. Yeah, unclean living conditions. Yes, we would be concerned about that. Another big thing is just when you have poor housing conditions, your house is often very porous, right? You might have like gaps around door frames or windows. You might not have window screens. And so all of these things can lead to more, more of the vectors coming inside the home. So even if the house is very tidy, if the house is just in bad shape, they might have more risk that way. So we kind of talked about all this. These are some key factors, some key challenges when we're talking about farm workers and any infectious disease. The one that I want to point out here is that because so many farm workers lack authorization to work or reside in the US, there's a lot of concerns about immigration status, especially when interfacing with any government agency, and that includes health departments. So we'll see later some of these diseases are notifiable, so they are getting reported to the CDC, and it's not logical for people to be concerned about that, to be concerned about their information getting reported to different government agencies. So as part of working with farm workers, we want to be sure and help returns and communicate clearly and effectively about why that information is important and how their privacy is being protected, things like that. And that is often much more effective when done through local trusted organizations, or different community leaders that already work with farm workers, especially if you are a public health agency or a government agency who's communicating with farm workers. It's really helpful to have that third party there to help you build rapport and trust with the community. Another critical thing with this is language access for farm workers. And we have many trainings on language access, But it's really important to make sure that, you know, throughout the whole process, that people who don't speak English can make it through, so that they're, you know, if they're getting exposed or infected, if they call the clinic because they're worried about it, when I call the clinic, am I getting sent to a phone tree in English or Spanish? Well, what if I speak Haitian Creole? You know, can I connect to an interpreter to get help setting up an appointment? So the whole process is really important to make sure that farm workers can communicate in the language that they speak with healthcare providers or public health agencies. Okay, so let's dive into the meaty stuff right here. This presentation really focuses on arboviruses. Again, because this topic of vector-borne diseases is really large, we are planning to do trainings on different vector-borne diseases, like bacterial vector-borne diseases in the future, but most of this presentation will focus on arboviruses. So there's actually more than 100 different arboviruses that are known to cause disease. We're not going to talk about all of them today. We'll talk about a few. And when we talk about arboviruses, this refers to viruses that are transmitted through arthropod vectors, and that includes insects that have 6 legs, like mosquitoes and fleas and lice. And it also refers to arachnids, like ticks or mites. So we'll talk a little bit about viruses that are transmitted through mosquitoes today, and a little bit about ones that are transmitted through ticks. So this is that zoonotic transmission cycle that Sarah brought up by explaining that an increased risk of rats or mice in the home could potentially increase someone's risk for a vector-borne disease. So what happens is we have these, you know, little guys like ticks that are biting wild animals, and if those wild animals have the pathogen in their bloodstream, then the animal picks it up and it can reinfect other wild animals, right? So it can keep going and it can kind of live in these wild spaces like that. And then we see it show up in humans, who are called dead-end hosts, when that little tick ends up biting a human instead of the normal rat or mouse. And humans in the US are usually considered a dead-end host. And that's because there's not much transmission happening where an infected human gets bitten, and then now that bug is to another human. That does happen outside of the US, but here it's mostly going to be in that zoonotic cycle, and then humans end up getting it, and it kind of stops there. There's other ways to get arboviruses besides just being bitten by a mosquito or a tick. It can happen, you know, through organ transplants or in blood products. It can happen between a mother and a baby, either in utero or through breastfeeding. And they can also be transmitted sexually, or if folks are working in a lab, it can be transmitted that way. So arboviruses vary in how severe they are, but overall, this is kind of the main picture. So most arboviruses, if someone gets infected, about 50 to 80% of people who are infected are not going to have any symptoms, right? So that gives you some indication that numbers that we do have on these diseases is probably an undercount, right? If folks are not seeking care because they're not getting sick. In about 10 to 30% of cases, people will have a febrile illness, and in 5% or less of cases, people will have severe disease. And this shows up in a couple of different ways. So folks can have a systemic febrile illness, which will be accompanied with rash, with muscle and joint pain. People can have neurologic disease like meningitis from arboviruses. They can also end up with a hemorrhagic syndrome. All of these are very concerning outcomes for people. There are some common risk factors too, especially important for farm workers are having chronic diseases like diabetes or hypertension or chronic renal disease. Those will all increase someone's risk for developing one of those severe syndromes, severe disease from an arbovirus. Increased age is also a concern. here for most of these viruses that will increase their risk of severe disease. Organ transplant recipients as well, which is important. Actually, last year, my aunt, who is a lung transplant recipient and lives in Colorado, got very sick with West Nile virus. Because these are viruses, there isn't, we don't have a proven antiviral therapy that will help. All of it is really supportive. And you're going to see it used more so in the severe cases or for patients that are immunocompromised or have those other chronic conditions. There has been research done to try and see if any of the therapies would be effective, would work, but the controlled studies have not shown a lot of effectiveness for these different therapies. So there's different testing options. Really, this is when, you're going to work with a state or local health department for testing. And in some cases, it would be the CDC that would test. And we'll talk about that in a bit. But there is, serology testing, basically just looking for antibodies. We can do PCR testing for some of the arboviruses, and there are molecular assays as well that can be done in severe cases or in the case of fatalities. Prevention, which is what we focus on, and we have some resources on prevention that I'll share at the end. This is, fairly simple and straightforward for all the different arboviruses, and it really focuses on preventing mosquito bites, preventing tick bites. So for farm workers, they're already doing a lot of this, wearing long sleeves and long pants, sometimes encouraging workers to tuck in their pants around their socks, especially if they're working in brushy areas for some reason. That will all help. Using insect repellent on the work clothes as well. And then in the housing, like we talked about, making sure that the housing is structurally sound and there's not big gaps in around doorways or windows or things like that, and making sure that the screens are in good condition and don't have holes in them where insects could enter the house. Air conditioning is also helpful. We know a lot of farm workers do not have air conditioning in their homes, but obviously when it gets hot, if there's no air conditioning, people are going to open up their homes, which will increase the likelihood of ticks and mosquitoes entering the house. These actions are really important because there are no FDA-approved vaccines to protect against arboviruses that we have here in the US. All right. So let's talk about a couple of mosquito-borne viruses. There's quite a few we have in the slides. You all will get a copy of the slides after this presentation. We highlight a few in this live training, but you can refer to basically an appendix of slides with more information about each of these viruses once we send that out. There's a lot to cover, and we wanted you to have all the information, but we're just focusing on a couple of them here today. So one that we need to focus on is West Nile virus, which is the most common cause of domestically acquired vector-borne disease here in the US. And it gets maintained in a cycle between birds and mosquitoes. We first detected West Nile virus about 25 years ago here in the United States. So West Nile virus is nationally notifiable. It is found throughout the globe, and it's considered endemic here in the US. The highest incidence is in the north central states like Colorado and Nebraska and North and South Dakota. These all have seasonal cycles, and so they peak in the summertime, so in July through October. So this is a map here. You can see this is the number of West Nile virus cases in different states from 1999 to 2022. And you can see that it's pretty high. There's a few states where there haven't been as many cases, like in Maine, Puerto Rico, and Alaska. So for West Nile virus, most cases don't have symptoms or don't show up in the clinic. When people do get sick, they might have fever, headache, weakness, that muscle or joint pain. And the incubation period is usually around a week, but it can take up to 2 weeks after being bitten. Less than 1% of folks who get West Nile virus will develop a neuroinvasive disease like meningitis. In that small proportion of cases that become neuroinvasive, 10% of those are fatal. And then people after that will often have long-term effects, like headaches or different cognitive deficits that happen. I know I used to take metalworking classes, and my professor had West Nile virus, and he had a whole bunch of long-term effects from West Nile and would complain about it quite loudly and frequently. But he really felt like kind of what reminds me of long COVID survivors now is they feel like some kind of brain fog, like they're just mentally not working as well. And that's how he described his experience of West Nile virus. Another mosquito-borne virus is St. Louis encephalitis virus. This was found longer ago, almost 100 years ago in the United States, when a big outbreak happened in Missouri, and it has the same cycle. So it goes back and forth between birds and mosquitoes. This is also nationally notifiable, and historically we've seen it more in eastern and central states, but more recently it's been showing up in the Southwest, and this has the same peak as West Nile. So July through October is peak season for this disease. You can see that there are not as many cases of St. Louis encephalitis virus as there were of West Nile, and that it's really much more focused in the South. This virus also has, so most cases are not going to have symptoms. When they do show up, again, it's fever and headache. This one has vomiting and malaise as well. It can progress to more severe disease. And when it does, the case fatality rate is higher than that of what we saw of West Nile. So it's estimated about 5 to 20% of disease cases. And that risk of fatality goes up with the person's age. All right, we'll talk about a few tick-borne viruses now. So we'll cover all of these except for Colorado tick fever virus, which is in the appendix slides. Powassan virus, this is the first one. So this one hides out in what are called reservoirs. So those are wild animal populations. So rodents and skunks will keep this virus alive and then get bitten by ticks, and then occasionally crosses over to humans. This got first detected in Ontario, Canada. Powassan virus, again, is nationally notifiable, which is something, again, to consider for farm workers who may be concerned about diseases being reported. This is primarily found in northeastern states and up around the Great Lakes. And this one differs in that severe disease can happen really in any age group. So even young infants up to our elders. And this one also has a different peak than what we saw with the mosquito-borne ones. So again, this is transmitted by ticks, so it makes sense that it would have a different seasonality to it. So this peak is May through July. You can see here the distribution of cases. So the dark blue states have had more than 10 human disease cases. And you'll see that up in Maine and Minnesota, areas like that. We don't have it in the South. Powassan virus is a much longer incubation period. So with the mosquito-borne viruses, we saw the incubation period in days. This one is in weeks. And so it can show up in people as just a mild febrile illness that is pretty nonspecific. They can have no symptoms. When they do have that sort of mild illness, it may be a fever, a headache, weakness, symptoms like that. This can progress to a neuroinvasive disease, and it can be quite severe. So when it does get severe like that, about 10% of those cases are fatal, and these survivors of neuroinvasive cases can also have long-term effects from the disease. All right, we're going to talk about two viruses that are kind of similar. The first one is called Heartland virus, and this was found more recently in the US, so just in 2009. Heartland virus is transmitted by Lone Star ticks, and we'll look at a map of where those ticks are in a moment. They have a pretty big distribution in the US. Heartland virus is not nationally notifiable like the other diseases that we've seen, but states are encouraged to report these cases. As of about a year and a half ago, there were 60 cases reported from different states in the US. And from what we know, this virus peaks in June, but it also has this summer seasonality to it. So these are the states that have had Heartland virus disease cases, just kind of more of the central states and some of the northeastern states. Heartland virus also has a longer incubation period. There's a number of symptoms that are a little more specific to this disease. So this one often shows up with fever, with leukopenia, and thrombocytopenia. People can also have fatigue, nausea, headache, diarrhea, the muscle and joint pain. It really looks a lot like a couple other tick-borne diseases that are bacterial. So it becomes really critical here in recognizing this, that for those bacterial tick-borne diseases, that gets treated with just antibiotics, with doxycycline. But if someone has Heartland virus, then it's not going to respond, obviously, to the course of antibiotics. So bourbon virus is similar to Heartland virus in many ways. This was also more recently detected in the United States. It also gets transmitted through Lone Star ticks. And so this is a map showing that, about half of the United States, you can find Lone Star ticks wandering around. Bourbon virus is also not nationally notifiable, but again, states are encouraged to report it. And there's been just a small number of human disease cases in the United States of this virus, but they have recently identified the virus in ticks in the state of New York. So this has similar symptoms to the ones that we just talked about for Heartland virus. And again, it can look like other bacterial tick-borne illnesses, but it's not going to respond to antibiotics because it is a virus. For testing for Heartland and bourbon virus, there aren't any commercially available tests, but patients with clinical and epidemiological criteria will have their specimens tested by the CDC. So that's, having a known tick exposure in the last few weeks prior during that seasonal cycle. So in the spring, summer, early fall, or having gone to an area where there's already been documented cases of Heartland virus. And then several clinical criteria would accompany that as well. All right, I want to take a brief pause here. We're going to give you guys a kind of a sneak peek about some of the bacterial vector-borne diseases, and talk a little bit about the work that we've done with CDC on bacterial vector-borne diseases. But I want to pause and see if there are any questions that any folks have. All right. So let me pull this chart over. So we have seen a rise in Lyme disease cases. So I mentioned at the beginning of the presentation that Lyme disease is one of the more common vector-borne diseases in the US. I'm curious if any of you in the audience know someone who has had Lyme disease. It's really common, especially in the East, but it has been increasing. some of the increases that have happened more recently are due to changes in how it's been reported, but there is an increase due to kind of expanding range of this specific species of tick that transmits Lyme disease among other things. Oh, good. There's that chart. I knew it was on here. It just disappeared for a moment. Rickettsial diseases are also transmitted by ticks. And those have also been increasing quite dramatically. Maybe our CDC staff can explain a bit more why we think they're increasing so much. Lyme disease. So this is the most common vector-borne disease in the US. It gets transmitted by black-legged ticks. So almost 500,000 people get diagnosed and treated for Lyme disease every year in the United States. And I've learned quite a lot about Lyme disease from our colleagues at the CDC recently. It does affect multiple systems in your body, you know, and people know Lyme disease because of the bullet rash, right? You get like a little red circle and then another red circle around it. But there's really a lot of pretty debilitating effects that Lyme disease has, and it can be treated with antibiotics. So that's why we've been working to kind of figure out how much workers know about Lyme disease, how much they know about tick prevention, and then trying to connect them to treatment if they are bit, because you know, we don't want workers to have to live with this. So Cindy asked how many people with Lyme disease. So about 476,000 people, and that's every year. So it's a lot. We did do an assessment with the CDC a year and a half ago in the state of New Jersey with different outdoor workers, and it was really interesting talking to workers about ticks and Lyme disease. And I had one really interesting conversation with a farm worker who was an H-2A guest worker. He had come from Mexico on a visa to work on a farm. It was a nursery farm in New Jersey, and he had been bitten by a tick. He didn't know about Lyme disease. You know, in many parts of Mexico, ticks don't even really bite people. They just bite livestock or dogs. And so he ended up getting really sick, but it was shortly before he went back to Mexico, and he was back for about a year in Mexico, really sick, and no one knew why. The doctors didn't know why. He ended up getting another visa and returning again to the state of New Jersey, and was still really sick and having a lot of joint pain and things like that. And it was only when he saw a doctor in the state of New Jersey who figured out what was going on. So it's really important to educate workers about this, especially in those states where there is a higher transmission or a higher incidence of Lyme disease. They do have to take the antibiotics for about 2 to 4 weeks, kind of depending on the situation. If workers are in an area of the country where they're at higher risk for Lyme disease, they can take just 1 dose of doxycycline, and that will help prevent Lyme disease, which is really great. Another critical worker education piece. Thank you, Grace, for sharing that CDC page. So a couple of things to consider here with tick-borne diseases is that, you know, they have a seasonal cycle. So if you are seeing patients who have a fever, who had an exposure possibly to ticks, it's important to think about that. They can all be treated really effectively with antibiotics and early treatment for folks, even if they're not sick yet, but are at a higher risk for contracting Lyme disease because of the part of the country that they're in. Then it would be good to get them in, you know, and get a prescription for that single dose of doxycycline. Another side story is I was recently doing outreach with farm workers who were headed up to the Northeast. They were going to New Jersey and then to Maine. And we talked quite a bit about ticks, and they they also hadn't heard that ticks can transmit disease. They were unaware of that. And we talked a lot about doxycycline and potentially taking that if they were bitten. And we also had to do quite a bit of education around that because, again, in Mexico, workers can usually just go straight to a pharmacist to get medications that they need, and they can talk to the pharmacist directly and they can give them. So we did quite a bit of education about, here in most anywhere in the US, you're going to have to go through a healthcare provider and get a prescription and then go to the pharmacist. So it is, kind of a barrier in terms of cultural knowledge and actual financial barriers since they have to see a healthcare provider first. So just another important piece of the worker education side. We do encourage workers to prevent tick bites by using, an effective bug repellent and applying it each day, and removing ticks that get attached to the body as soon as possible. So doing tick checks and all of that. I think a lot of hikers have become aware of this information, especially up in the Northeast or some other parts of the country where you find ticks all the time. But workers who are coming here from other countries might be really unaware of all these prevention techniques that other folks are aware of. So, we talk to workers about taking a shower as soon as they get home, which is also important for pesticide safety measures. And then, being sure to check their body, especially places like their armpits or things like that where ticks like to hide, or the back of the neck, and making sure that they check themselves every day so that ticks aren't stuck in the body and increasing the likelihood of transmitting a pathogen. So you can see here, there's some materials that CDC has developed for tick removal. The best way is to use tweezers so that you're pulling the whole tick, right? A lot of us maybe have dealt with that, where you pull a tick out and the body separates from the head. So you want to try to get the whole tick out of the skin. And then it's important after it's removed to clean the bite wound, clean your hands with soap and water or alcohol if it's available. We'll drop the link in the chat. As a result of that assessment we did a year and a half ago, we collaborated with the CDC to develop some new worker materials about Lyme disease and about preventing tick bites. So there is a poster that's for clinics or for healthcare provider offices and things like that, and it provides some really basic information about doxycycline. Basically, that people, if they have been bitten by a tick and they're in an area where they're at a higher risk for being exposed to Lyme disease, that they can get a low-cost medication. And so it encourages workers to take that action and contact a clinic if they have been bitten, so they can receive that prescription. And those posters are available in English, Spanish, Haitian Creole, and the Guatemalan language MUM. And then we also have a pretty short, I think it's 6 or 7 minutes long, training video, and that's really aimed at outdoor workers. And it kind of goes through 2 workers learning about the process of preventing tick bites, how to do it, what to do if you get bit by a tick, how to remove the tick, and then, encouraging practices like using insect repellent, long sleeves, long pants, etc., while they're in the workplace. And so that was really fun. We worked with 2 men who have worked both in farming and landscaping to do that video. And there are some shorter social media clips with some key points that you can use on WhatsApp or on Facebook or Instagram or things like that if it's not appropriate to share a 7-minute video. All right. This is my email in case anyone has any questions. I want to see, let me go down one more slide. I want to see if there's any audience questions, and if there isn't, I'm hoping that CDC folks could share some insight into why we're seeing more vector-borne disease, especially more of those bacterial tick-borne diseases lately.
Bethany, we had a question come through the Q&A box, if you can see it.
This is a great question. How is climate change impacting vector-borne diseases? Yeah, so I can share a little bit. Katie reminded me that so you have to raise your hand to be unmuted if Meredith or Stacy or Grace wanted to weigh in on this, but from what I understand, it's mostly about changing temperatures and changing the range in which certain species of mosquitoes or certain species of ticks can inhabit. So places that may have previously been too cold are now warmer, and they can inhabit those places. That's my understanding, but yeah, Erin, you can unmute, Erin.
I think I did. Can you hear me?
Yes.
Okay, thanks. My name's Erin Staples. I work with Stacy in the arboviral diseases branch. And I guess whenever anybody asks me about climate change and how it will impact arboviral diseases, the ones that you reviewed quite nicely that are transmitted by mosquitoes and ticks, my answer is it's complicated. Just as you pointed out, Bethany, there will be an increase in where these diseases are found, as we expect warmer temperatures will increase the suitability for different mosquitoes and ticks. But sometimes we also see a negative impact. So if the temperatures get too high, a good example that I remember from recent history is why, for instance, we tend to see more local dengue transmission by Aedes aegypti in Florida than we do, for instance, in Arizona. And in Florida, obviously, people are living outdoors. It's a much more sort of suitable climate to hang outdoors, and it doesn't get exceptionally hot, though it can be muggy. In comparison, Arizona does get up to, well over 100, and the Aedes aegypti during the day, for instance, it's too hot for them above ground, so they actually go down into the sewers. So it does change sort of the dynamics of the diseases as we know it. So it's not always straightforward. More rain at the right time can increase mosquitoes, which can increase the risk of mosquito-borne diseases. But mid-season hurricanes, for instance, wipe out, the presence of mosquitoes in water holding containers and actually break the cycle a little bit and don't appear to impact it. So again, just a summary of how definitely climate change impacts our disease. How it impacts it in a specific location is pretty complicated. And to get at your other question, I think it was more for our bacterial diseases. We do see, for instance, we are seeing more and more Powassan disease cases. We do think that is probably a combination of the spread of the tick vectors and just the hosts that are amplifying that kind of spreading out over time. But we also know, for instance, with Powassan, a lot of it is disease recognition. Up until 2000, we really didn't know about Powassan in the Midwest, for instance, but following the death of an individual where their sample was submitted to an unknown death registry, we identified Powassan, and then Powassan came onto the radar for people. So some of it's a clinical recognition, and some of it is also just expansion of the vectors and even the reservoirs that can amplify it. But I'll stop there and turn it back over to you, Bethany. Thanks again for presenting.
Oh, thank you for that great explanation. That's really insightful. Yeah, I know in Texas, at least where I was this past summer, it was extraordinarily hot. And everybody was noticing that there were less mosquitoes just because I assume because it was so hot and dry. So you're right, I guess you can go both ways. There is another question about any materials on what the bullseye rash that I referred to looks like. There are materials. I believe there might be one on the CDC page. Yes, thank you, Grace. Yeah. So there's a picture of that rash there. People can have asymptomatic Lyme disease, so they may or may not know. And again, CDC can provide more information on this, but it's my knowledge that some cases can get misdiagnosed, or people can come in sick with a fever or feeling weak or having joint pain, but they didn't realize they got bit by a tick, which is kind of a critical piece of information because it can be a little non-specific, I think. But please correct me if I'm wrong, CDC experts.
Yeah, this is Grace Marks. Thanks so much, Bethany, for presenting on Lyme disease specifically and other vector-borne diseases today. Really fantastic overview. Just to maybe answer a couple of specific questions that came up, I completely agree with Dr. Erin Staples about the expansion of certain vectors. Climate change, I think, certainly does have a role there. There's also other factors, including the distribution of host animals such as deer, for example, in the Northeast, and reforestation, and just the way that humans interact with their environment. So it's certainly a complicated milieu, I think, of factors. But we have seen a lot of increase in Lyme disease, certainly over the years. And part of that is really expansion of that tick vector. The question about what erythema migrans looks like is a really great question. For most people who have Lyme disease, they do develop the erythema migrans rash at the site of the tick bite. But the challenge is, as Bethany mentioned, sometimes you don't see the tick bite, right? I mean, it could happen on your scalp or on your back. And so you're just not aware that you got bit by a tick. And then it may not be in a location where you would see that rash. So certainly there are many cases of confirmed Lyme disease where people just were not aware of that erythema migrans rash. And it can look different. I think one other thing to mention too is that it can look different on different skin tones. So a lot of the traditional materials by erythema migrans has unfortunately been on people with white skin. Well, that is not very representative of people who get bitten by infected ticks and get Lyme disease. So what we've been trying to do at CDC is provide more materials, more examples of erythema migrans rashes on people with darker skin tones, which I think is really critical, but it can be a little bit harder to detect. And clinicians may not be as familiar with different rashes as they might appear on people with different skin tones. So again, something to be aware of. And then I did drop a couple of links in the chat there in answer to the question about how to diagnose Lyme disease, but it is a serologic test. It's a 2-tier serologic test. So it requires kind of 2 tests, both looking for antibodies for Lyme disease. And there are, of course, some limitations there. Antibodies can take time to develop, so you might miss it if someone's coming in with early Lyme disease like that erythema migrans rash. But you can certainly encourage people to follow up a couple weeks later, a month later, and then you should certainly see that those antibodies appearing at that point. So hopefully some of those links help, and we look forward to having additional webinars down the line where we can go into this in some more detail. Back to you, Bethany.
Thank you, Grace. That was really wonderful information. There's another great question that I like on here. So has there been any success with messaging about using window and door screens and air conditioning in the farm worker population? If housing conditions are poor and difficult to fix, is it even worth it to suggest that kind of messaging? Have you seen agencies been able to work with local organizations to get funding for repellent, bed nets, AC units, etc., for mosquito bite prevention? I think this is really interesting, and I know I'll say a little bit, but I know that our CDC folks have worked internationally where the resources are really limited, and so I would imagine there's some insights into how folks in other countries deal with that, with the housing conditions and reducing their risk of getting a vector-borne disease. I think for farm workers, because so often the really poor housing is employer provided, this is a good opportunity to connect employers to USDA resources. There are so many USDA resources for improving rural housing, rural buildings for farm workers, in addition to other types of funding. So, farm workers directly are going to be really limited in terms of what they can do. We can certainly teach folks about the risks, because it's always better to know, I think, so you can mitigate risk whenever possible. But if we want to actually improve the housing conditions, then those are good opportunities for collaboration with rural housing development funds and those types of projects. I personally don't know of agencies in the US are working on this right now with farm workers, but I can definitely ask around, and feel free to send me an email and I'm happy to follow up with that. Do you, Grace, or others, do you guys know of any interesting programs that have been done outside of the US for that?
I do not, unfortunately, but would defer to others like Erin if they have insight.
Can you hear me?
Yeah, this is Erin Staples again from the Arboviral Diseases branch. We have worked with other ministries of health. So for instance, in Brazil during the large Zika virus outbreaks, to ensure that insect repellents were made available to those most at risk, which would be women that were pregnant or thinking about being pregnant. But I do think there are in any place economic challenges and just access challenges. And I think Bethany, you pointed out some very good, thoughts about particularly the farm worker community. I think the other thing is we've had some success reaching out to the manufacturers of certain repellents. And I think, if there is momentum, there could be a desire to reach out to and work with, for instance, some of the individuals that might contribute, whether it be wood or the screens to build or allow those to be built. I think there is if people are reached out to, I find they answer yes more than they answer no. So, and I think them getting back to, how to get farm workers to do it, I think we often find there is a lack of awareness about these diseases. So even just communicating, starting with what are these diseases that you're calling vector-borne diseases and what does this mean to them? Once you can empower them with that knowledge and understanding, it gives them more of a incentive, or at least they feel like they understand why you're telling them to do something. But those are just some of the things that have worked, and not always successfully. It just depends on your population. In the past, when we've done some outreach and tried to improve awareness and also use of prevention measures. Thank you. Back to you, Bethany.
Well, thank you, everyone. This was wonderful discussion. I'm gonna pass it back to Katie now. She has a couple of announcements and we have our evaluation link as well.
Thanks, Bethany. Thank you all for our CDC folks jumping in and answering questions. Any additional questions that you have, feel free to put in the chat and we can either answer them before we sign off today or make sure you get a response and follow up. So we did want to share a little bit about the Midwest Stream Forum and offering NCFH organizes. That's happening next week in Albuquerque, New Mexico. We're still accepting registrations if you're interested in joining us, and focusing on agricultural worker health, and lots of interesting sessions and topics. Next slide. We also wanted to share about our commemorative artwork. Each year, NCFH commissions an artist to create an original image for our commemorative artwork series. The sales of these commemorative artwork prints, posters, note cards go towards our scholarship program, and more information is coming through the chat about that. And this is where our live session will end. And I'm going to stop the recording.